Assalamu alaikum, hello and welcome to The Health Show, live here only on the Islam channel with me, Alistair Greener. As usual, a health show aims to cover all matters concerning your health and to keep you healthy and informed by discussing a range of topics. And we do encourage you at home to call in and talk to us about these very issues because we'd really like to get your questions answered. Now, we must stress that should you suffer from any medical problems, it's always highly recommended that you contact your doctor or GP, as the health show gives you an alternative viewpoint to the health concern being discussed. If you'd like to speak to our expert today, the number to call will be 020 7374 6423. But don't call just yet, as the lines will only be opening up later on in the show. And you can also email us, if you prefer, healthshow@islamchannel.tv. Today, we're going to be looking at kidney disease and its effects. And to discuss this topic, we're very pleased to welcome Mr. Shahid Mohammed. And Mr. Mohammed is a specialist biomedical scientist and a registered scientist under the Science Council. He also has a specialist interest in paediatric nephrology, immunology, clinical biochemistry and haematology. Good afternoon. Thank you very much indeed for joining us.
Thank you for inviting me.
You're a busy chap, but we'll talk more about that in a while, because before we talk more with Mr. Hamid, let's take a look at a story of an extremely premature infant weighing just 820 grams, who, according to his doctors, has become the world's smallest and youngest patient to escape death thanks to an artificial kidney.
Little Kamil will soon be 5 months old. He's the picture of health, but in fact he's very lucky to be alive. Kamil was an extremely premature baby, born 15 weeks early. His organs were on the brink of collapse and his condition was deemed critical on day 10.
His heart muscle and heart rate were very weak. Then his kidneys almost stopped working. In 3 days, Kamil produced just 50 millilitres of urine, and he'd absorbed 450 millilitres of liquid. He suffered horrible swelling.
His physicians in Legnica, western Poland, decided to try the impossible to save his life. They hooked Kamil up to an artificial kidney. The device pumps blood from the patient, filters out impurities, and then returns the clean blood. It's used on newborns weighing at least 3 kilograms. Kamil weighed in at just under 1.
Kamil is the smallest baby in the world to survive using this method. It has already been tried with children as small, but none survived.
With public spending on healthcare in Poland still low by Western standards, not all Polish hospitals have dialysis machines. Kamil had the good fortune of being born in one that did, thanks to Poland's most popular annual telethon. Over 23 years, it's raised about $160 million.
The medical standards in communist Poland fell far short of those in Western Europe. Today this has changed. Services, especially paediatric ones, are very well equipped, but doctors still want to go further, and NGOs can help them.
After nearly 5 months in hospital, Kamil can finally go home.
It's a miracle what happened. When I think back to his birth and compare it to what I see now, it's night and day. What we experienced as parents, it was tragic. It can't be put into words. You have to experience it.
Infant dialysis worked for only half of the 10 cases treated at Legnica Hospital. As a world first, Kamil's case gives hope for more happy endings in the future.
Well, Mr. Hamid, that was an amazing story, wasn't it, to be able to see 820 grams. We saw how small the baby was. Dialysis is something we hear a lot about when it comes to kidney function. What exactly is it doing?
So, in a nutshell, what kidney dialysis does is basically helps to refine the blood, cleanse the blood, but also helps to get rid of waste and toxins in the blood. Because the nature of the kidneys themselves actually just help to get, mainly is a body cleansing system, filtering the waste and cleaning the blood. That's what it does on a daily basis. And we heard in this little example of this patient, some pediatric or even neonate, that they're so delicate, and you can imagine the organ at that stage is so vulnerable that the dialysis machine would have to be put on a really slow rate to get rid of the toxins.
So effectively dialysis is sort of bypassing the kidney, is it?
Yes, it is. But if there is some residual function of the kidneys that the patient might have, or the individual has, then that will work a little bit, but it won't work to full capacity.
OK, so let's get back to real basics. The kidney itself, you said that the kidney is there to effectively clean the blood. That's its purpose.
Yes, yes. And on a daily basis, if we were thinking about how much fluid and fluid consumption we would have up to between 2 and 4 litres a day. Now, that fluid that we consume through water, teas, coffees, anything that you would drink, or even within food, that will get filtered and then it will go through the kidneys to get excreted. The body then reabsorbs any nutrients from that it needs, such as glucose, and that we would keep, and then the rest would just go through excretion, through urine.
So a remarkable function. So what can go wrong with the kidney?
Well, the kidney, we have two, naturally. Now, because they are very vulnerable organs, they have various functions. They control things like our calcium metabolism, our potassium, our long-term blood pressure regulation, obviously, as mentioned, excretion of waste through urine, and it has other metabolic functions. Now, the problem is that because they're vulnerable, there's a lot of information out there to say that even medication that we might be taking, some simple analgesic medication like paracetamol, this can damage the kidney over long term if we were taking that, constantly. So this is something, there's a lot of work going into this, and that function, it reduces over time. And if it becomes really bad, it's something called acute kidney injury.
And how will that manifest itself? How will someone typically discover that they have something wrong with their kidney? What will they experience?
So because the kidneys, they're very... In normal functioning kidneys, they're very efficient, very effective. So even if you don't, a patient or individual may not feel any symptoms straight away, but it could be something very subtle, like having difficulties going to the toilet or going to the emptying the bladder more frequently, for example. That could be a sign, for example, of having a urinary tract infection. So if a person or individual has a urinary tract infection, my advice would be get an appointment with the GP.
It's like many of the things we talk about on the show. If you discover something a little bit different that's not as it was, then that's your perfect cue to go to the doctor.
Yeah.
Now, we also hear about kidney stones, and I heard you talking there about the sort of calcium function. Tell us a little bit more about that.
So calcium is a major metabolite in our bones and also helps in muscle growth, and in paediatrics or kidney neonates, it's generally important for growth. And so what can happen in more in the adult population is that if the bladder becomes weak, that can also affect the kidney. And then what happens is the kidneys, if they're not functioning as according to what they should be, then calcium can accumulate. And this causes calcium stone, which is called calcium oxalate, that can actually accumulate within the ureters of the kidneys. So the ureters
Which is why
are the
people
tubers.
Experience that extraordinary pain.
Yeah. And that pain is so extensive sometimes that it can affect the back as well. Your kidneys would normally lie in the front in the abdomen area, and the problem is that because of where they're situated, they can be vulnerable in that respect as well.
And of course, a kidney stone is somewhat different to other kidney diseases and so on.
Yes.
And obviously, if you're experiencing any of these pains, again, go and see your doctor.
Of course.
But the treatment for extreme kidney stones, so if the pain is so bad, is that something that becomes you get operated on?
Yeah. So if the pain is so bad, first, an individual will definitely feel that. They will find that they're trying to go to the toilet or emptying their bladder. It will be almost impossible. They will feel that they will get tiny amounts of urine being voided, but basically they would be in a situation where they would have to have surgical procedure to get rid of that stone.
Because the stone's effectively blocking.
Yes, it's causing occlusion, and this is where this is when a GP would then think we would have to refer them to a specialist kidney doctor.
Coming to actual kidney disease itself, you know, we talked earlier on about dialysis and things. So that would imply that there's something in the blood that's not working as it should. What sort of causes are there that would lead you to have that? So
there's a number of causes. We talked a little bit about medication. Someone might be in the long term, if an individual is taking medication, the kidneys, because they're sensitive organs, these medications can affect the kidney in the long term. There's also diet and nutrition. Obviously, too much fatty type foods can cause problems with the vascular nature of the veins leading to and out of the kidney.
So similar to, you know, we might have a blockage going towards our heart, or other part of the body going to the kidney would have a similar effect.
Yes, it would. Yeah. And the issue here is that, and really to point out, is that one of the things that we can do, and we'll probably talk a little bit about this, is that one of the things that can hopefully prevent some of this occlusion or obstruction is keeping active, because that will help the blood vessels to open.
The other thing we hear often especially with kidney stones and with kidney function generally, is to be drinking lots of water. What's the science behind that?
So there's some basic understanding with that, is that because the kidneys themselves, they're perfused organs, and what that actually means is that where the nature of where they are and how they have been, how they are in naturally, they are very water-based organs. So the science and the understanding behind that is basically that it's very important to keep a minimum of 2 litres on board of yourself every day, because they're very water-based, and that will keep your urine sterile as well when you're going to the toilet. So
if we hear often, we've seen pictures again, that if your urine should be sort of straw-coloured, and if you've got signs of dehydration, then obviously drink more water, and being dehydrated will potentially damage the kidney, would it?
Yes, it would, because naturally the urine colour, or the nature of the colour of the urine is almost very clear, and that has to be constant throughout life. And if there's a change in colour, maybe it's more yellower than normal, or it goes slightly darker than yellow, then that's actually something to be concerned about, because you could be leaking a component that you wouldn't normally, that shouldn't really be leaked through the kidney.
Can the kidney, you know, we hear quite often about the body, it has this remarkable ability to repair itself.
Yes.
Is the kidney one of those areas of the body that can do that?
Unfortunately, whilst there's a lot of research looking into this, at the present moment, the kidneys don't actually repair themselves like the lungs or the liver and even heart muscle. There's a threshold to some of the other organs, and up to that threshold, they would start repairing if they're damaged. But with the kidneys, because they're so vascular, they're very... the functional components are so vulnerable that if they are damaged in any shape or form, they cannot unfortunately repair themselves.
We hear a lot about dialysis, and dialysis is often seen as a temporary measure until someone can get a kidney replacement.
Yes.
And you said we normally have 2, but I've heard this thing, we don't actually need 2.
No, that's very true, and it's amazing, really, because we can have a normal life and function normally with just 1 kidney, and it's because on a daily basis the kidneys would still get rid of the waste and cleanse the blood on a daily basis with just 1 functioning kidney. and because there's an element of growth within the kidney once a transplant has happened, and some of those, it's not necessarily about the cells regenerating. It's just putting the vascular access back from in and out of the kidney once the transplant has been done.
So again, we hear about relatives being good matches and so on, and donating kidneys.
Yes.
How big a procedure is having a replacement kidney?
So the procedure itself is not very traumatizing, and actually these transplants are happening quite regularly or quite routinely. And some of the major hospitals in London and where I'm from in Bristol, there's these transplants are happening quite routinely. The biggest hurdle to these happening is the first step any individual has, whether it's a donor who's wishing to donate and a recipient to have the transplant, is that it's about matching the blood group in the first place. If the blood group matches, then that's stage 1 passed.
Right.
Then after that, it's some tissue typing tests that are done, and that comes down to a lot of what the lab work, the labs do, to make sure that what we call a cross match is absolutely suitable, so the donor's kidney is viable to be transplanted into the recipient.
And once the recipient has received their kidney, how quickly are they up and about and functioning normally?
So it's a very important point to make, because in some individuals they can be in and out of the hospital setting within an intensive care unit, for example, in probably a week or a week and a half. And this depends on how potentially fit that individual might be in the first place. So some say the stronger or the fitter the person, the quicker they are out. If it's it's someone who might be slightly older, then it can take a bit longer to recuperate. And also, again, medication. If an individual is on quite a lot of medication, this can take a lot of impact on the recovery time of an individual.
Let's look at the actual causes. You talked a little bit about diet and so on. Is there almost like a natural age when we're more prone to kidneys not functioning properly because we're getting older and it's starting to wear out? Is there anything hereditary amongst it? How does that side of it work?
So it's kidney disease, in essence, we saw from the small video clip that you showed, that it can actually happen in any age, any race and any gender. There's no real natural restriction in that respect. But in those patients who are, for example, diabetic, have type 2 diabetes, they can become more vulnerable. And we know that for a fact that those who are categorized almost as being diabetic, they tend to be over the 50s and 60-year-old patient population or age group.
And of course, that's also often directly related to weight and general health, isn't it?
So again, physical activity, anything that you can do to increase the blood flow to the kidneys and out of the kidneys, that's actually a very good thing you can be doing.
And it's having the side effect of helping your heart and other functions as well.
Exactly. And I think it's very important to make the point that with the nature of the kidneys, again, it can affect any age or any age group and any population. The issue is it's about self-caring. If you know that there is something wrong that is not normally, it seems kind of almost abnormal to you, then it's a quick prompt, really, that you need to go and refer to see a GP.
What would happen if you don't actually respond to any of these little prompters? Ultimately, if you have full kidney failure, what happens? What's the process, if you like?
So what will happen is that if you've got abnormal pain going to the toilet and your urine, for example, looks a different colour than usual, and also that you might have back pain, you might be feeling fatigued, more tired than usual, and these are almost small prompts for you to get a health check in the first place. If they then find, well, we might want to do, they find that, well, it might be worth doing a kidney test, they can do that by doing, the GP can do a blood test. That will then come to the labs, and that test is put on a laboratory analyzer to detect whether a patient or individual has or is at risk of having kidney disease.
And if you catch it really, really early,
yes,
can you slow down the degenerative process?
Yeah, I mean, there are 5 stages in kidney disease, and stage 5 being the worst, which means then the patient would have to be, would already be on hemodialysis, which is a form of dialysis, or something called peritoneal dialysis, and they would be, at this stage, be listed as a potential person or individual to have a kidney transplant. But before it gets to stage 5, normally it's caught at stage 3. And the stage 3 is actually categorized by A and B. A is subtle, but B is more progressive.
Well, we'll talk a lot more about this after the break. I feel like we're literally, as usual in these situations, there's so much to talk about. And the more we talk about it, the more we find out, and the more we suddenly realise we want to ask as well. But we'll be back in a short while. But it is time for a short break now. But when we return, we'll be answering your questions. So don't go anywhere. We'll be right back. Hello and welcome back to the Health Show, where our topic today is kidney disease. Now, the phone lines are now open. The number to call is 020 7374 6423. Again, that's 020 7374 6423, the same every week. And you can email us, as always, at healthshow@islamchannel.tv. Once again, we must stress that should you suffer from any medical problems, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. And just before we take your first calls, we want to talk a little bit about, you know, the hereditary nature of kidney disease. So if there's kidney disease in the family, or maybe a parent has it, are you more likely to get it?
So there's one particular kidney disease that's probably on the top of the list of any specialist in this area in some respects, and that's polycystic kidney disease. Now, that is if there's a history in the family, and in particular in the female side of the family, who might have polycystic kidney disease, this then can be passed on to the next generation.
Is that particularly common, or is that quite rare?
It is. There's 2 types. There's polycystic kidney disease in a recessive form, and there's polycystic kidney disease in a dominant form. So what happens in the dominant form is that basically it's passed on such that the genes for this particular disease are going to be passed on, and the individual, the female individual, is passed on to, won't have the disease straight away and almost be symptom-free up until almost 20 years of age. Mm-hmm. But then the signs start kicking in. Like we mentioned previously, there might be issues in urine flow, and might be issues with blood pressure and things like that.
And then the process to deal with that is the same as anybody with any form of kidney disease.
And it is quite a horrific sort of disease in some respect, because what happens in this disease, it causes cysts to grow on the kidneys. So it's almost like pus-type cysts that happen internally onto the kidneys. And this is then dangerous, because it means that this individual will definitely have to have a kidney transplant, unfortunately.
And looking at, you touched earlier on the different types of people who get it. You talked about diet and nutrition, and maybe the lack of drinking water and so on. You did say that ethnicity didn't really make much of a difference, people from different backgrounds and different ethnicities. However, we were talking in the break a little bit about, you know, certain people whose diet might lean in a certain direction would maybe contribute.
So it's very important to know or understand that in certain cultures, there's different types of different lifestyles, different food types, and in the Black and Asian communities, I think we see that there's a bit more of a predominance in diabetes, for example. So
and diabetes is a direct link.
It's more direct link to kidney disease, because there's with diabetes there's again issues with the blood flow to certain parts of certain organs, and this is where kidney disease can be one of those organs that gets affected.
Perfect. Well, if you do have any questions whatsoever to put to Mr. Mohammed, please do give us a call. The phone lines are open right now, so feel free. And the chances are, if you've got a question, there's somebody else at home thinking exactly the same question. So please do give us a call. You can stay anonymous. That's absolutely fine. But maybe you have a concern about your own particular health, or maybe there's somebody within your family that you're concerned about. You know, we know that certain people in our families aren't terribly good at going to the doctors. They talk about different things, they might complain about different symptoms, but actually don't do anything about it. So if you would like to ask Mr. Mohammed any questions about that, then please do. And, you know, we look at, you're talking about working in Bristol. How is Britain in terms of our research into kidney failure and so on? How are we doing compared with the rest of the world in that?
So actually in the UK we are getting a lot more depth into kidney research now than say previous 5 to 10 years. There's specific forms of kidney disease that, you know, some centres, some research hospitals are actually focusing on. Protein leaking is one of those areas, and University of Bristol.
And what's protein leaking? What's that mean?
So basically, because the kidneys, they do a lot of filtering on a daily basis to get rid of waste again, and to also replenish our blood stores. If, for example, we have something called albumin, which is a big protein, it's a big protein. Normally, you wouldn't get any albumin leaking. It's such a big protein molecule that you wouldn't really get that leaking. But it has a tendency that it can potentially leak. And if there is...
So that means it's passing through the system rather than being absorbed by the body,
or it should be staying as almost stagnant. If this is leaking, then it's potentially going to cause kidney damage.
Well, we've got our first caller on the line, so a very good afternoon to you. If you're able to, tell us who you are, where you're calling from, and Mr. Mohammed will answer your question.
Okay, my name is Sawa. I'm calling from London.
Okay, good afternoon. What would you like to ask?
I just want to ask, I was listening to the program about, and doctor was saying we should have 2 liters or 4 liters of water a day. Mm-hmm. What will happen in Ramadan when we are fasting and it takes like a couple of 10, 15 hours, 18 hours of fasting? What happens to our kidney during that time?
It's funny you were saying that, because we were talking actually in the break while we were off air. We were talking about Ramadan and the challenges, as you quite rightly say, of being able to drink that volume of water during Ramadan. So what's your advice on that?
In the Ramadan etiquette is that, firstly, for anyone who is prone to having problems with their urine flow, for example, or having problems with kidney disease, then it's almost, it would be, though you would still do Ramadan, you would still participate in it, you would want to make sure that you can replenish the fluid stores as soon as you open your fast, but not in, a massive amount straight away. But if you definitely know that you're at risk of kidney disease, it's worth going to the doctor to check that out, and then they can advise best whether you should or should not participate in this Ramadan. Because
obviously you shouldn't be doing anything that would actually endanger your health.
Yes.
But if, say, someone is healthy, and I'm not sure whether they are susceptible to kidney problems, but if you're a normal, healthy person during Ramadan, and your liquid intake is going to be less because you're fasting for so long, especially this year and last year, where the time of year that it falls, Is that going to be okay for that period of time?
For those individuals who are otherwise perfectly healthy and their kidney function is normal and everything is fine, then there is no issue. There should not be an issue in participating in the fasting, and also there shouldn't be any issues in replenishing those stores before starting the fast and afterwards.
But drink a reasonable amount of water during the time that you can.
Yes, exactly.
Yeah.
That's very important.
Perfect.
Yeah.
Thank you very much. And I know that will be a very big question for many people. And we have our next caller. Very good afternoon.
Hello, good afternoon.
What would you like to ask Mr. Mohammed?
Hello.
Yeah.
I want to ask one question.
Yeah, go ahead. What would you like to ask? Okay, can you hear me okay? I'm not... No, maybe try redialing and we'll hopefully be able to take your call in a few moments. I'm not sure if we have anybody else there yet. Not at the moment. Okay, so if you, please do. The lines are open and you will get through, so please do give us a call. While we talk about that, we talked about this 2 litres and 4 litres. Actually, we'll hold that thought for 1 second. We do have another caller, but I want to talk more about water intake and how that is in a while. But I believe we have another caller, so good afternoon.
Good afternoon. I want to talk to doctor, please.
Yes, please, go right ahead. What would you like to ask him?
I have a problem with I'm diabetic.
Okay.
Yeah.
I am going through, I have back pain.
Back pain, okay.
I'm going through back pain and my leg pain. Mm-hmm. At the moment, I can't get up in my bed also now 2 weeks.
Okay.
Okay, yeah.
I don't know what to do because I'll ring for my doctor also. It's difficult to get the appointment for me. You can tell for me what I can do for that, please.
Well, certainly very sorry to hear that you're feeling so unwell at the moment, and hopefully you will improve in due course. The one question I guess we have to ask is, are you aware of it being a kidney problem, or is it something that you're not sure what the problem might be?
I don't know what's the problem because I have a pain in my tummy also.
Okay. Mm-hmm. Yeah, so, no, it's a good question. If I mentioned before that if you start feeling tired or you feel that you can't walk, for example, the sort of same distances that you would be otherwise used to, then it's important to get a health check and ask quite openly that you want to have you'd want to get a test on your kidney function, because if there's signs of fluid accumulation on board, this can actually show up on our legs and sometimes even on our lower back. So what's a good sign that we can all do is if you think that you've got some fluid on board, along with any other symptoms that you think you might have, it's worth pushing your index finger, your normal finger, into the skin. And if you see that you've got some indentation, this is what we call pitting. That could be signs that you've got a lot of fluid on board that you would otherwise be excreting through urine. So in the first instance, I would advise the caller to get a health check. It might be worth, if you can't get an appointment, go through to the 111 service and they describe your symptoms to the 111 service team, and they can hopefully refer you to, That's a very good tip. The refer accordingly.
I know in certain parts of the country it is very challenging to be able to get an appointment. So calling 111 and getting someone to advise you, that's a very, very good tip. Just before we take our next call, I want to come back to this water situation, because we hear a lot about we should be drinking between 2 and 4 litres a day.
Yes.
But that can be in our food
Yes.
and so on. So what are we really talking about in terms of actual physical water? And is it as good having tea, coffee, milk, other fluids rather than water? Or should we really be drinking a certain amount of just water?
Yes, good question. So I think the best advice on this is actually making sure that you actually drink actual water. We do get water through all our food, through food types, and also teas and coffees. But the issue with teas and coffees is that they also act as a diuretic. So you actually end up wanting to void urine more. So you lose quite a bit of water through that.
So you almost become more dehydrated by hydrating.
Yes.
Right, yeah.
So it's very important to have natural water because that cleans the almost plumbing system, if you like, through the kidneys.
And as you said earlier on, the simple test is just look at the colour of your urine, and if it's sort of that light strawy colour, then you're probably doing okay.
Yes, exactly. And I think one thing that we could also be doing is, again, I've mentioned exercising, trying to keep him fit. Even if we can't, maybe then, no one can we can't all go to the gym, for example, but we can get involved in light walking and doing short walks. That's going to be good for you because that will open up the arteries and the blood vessels leading to and from the kidney. And that, with taking on water, that will actually keep you very healthy on the kidney side.
Brilliant. And if you are thinking about calling, please do. We've got time maybe to take one or two more calls. So if you'd like to call us, please do. And again, if you do send us any emails, we'll certainly pass them on to Mr. Mohammed as well. And we'll definitely answer you with that. I want to talk a little bit more about general health, because every contributor we have on the show, weight always comes up, nutrition always comes up, and it seems that the kidney is no exception to that, that it's actually its vulnerability is, a lot of it will come down to lifestyle.
Yes, and I mentioned previously that the kidney organs have a massive role in regulating and monitoring our long-term blood pressure. Normally, we have this preconception that we think that it's the heart that has a lot of involvement in regulating blood pressure, but actually, in the short term, the heart is very important in that side. But in the longer term, the kidneys are very, very important in regulating your blood pressure. So the point to make here is making sure that you can control your blood pressure, because this will add longevity to your kidney function over time. And obviously, again, drinking water and keeping up fluids in the best way you can is also going to be very important. I think diet, again, is it has its role. But my advice would be, even if you like your sweets and things like that, which we're all prone to.
Let's be honest, we all do, yes.
It's okay to have all of that in moderation, but you have to fit that in with a sort of semi-active lifestyle if you can. Today, we're always hustling and bustling, but we got to...
Absolutely. Yeah, we do have one more caller. Okay. So good afternoon. Where are you calling from today?
I'm calling from London. My name is Fatima. I just want to ask Doctor, my daughter do drink water, but she tends to drink like the sparkling water more, and I'm a bit concerned. I don't know if that is going to affect her kidney or not, or it's just...
Okay, so you were saying it's a specific type of water your daughter's drinking?
Yes, sparkling water. She do drink a lot of water, but sparkling water
so
she drinks.
We actually hear about this as well, because obviously there's the sodas, which are the sweet, like colas and things like that. But what about just plain sparkling water? Does it make any difference to the kidney function? Thank you very much for your question. That's a really good one.
Yeah. Sparkling water it's not a bad thing, but it's more what we call carbonated. So it has more bubbles, if you like.
Yeah.
And so those bubbles... though you can't taste it from the get-go, from the front of your tongue, for example, they do carry a taste, and they actually can contribute some sugar substance to your body as well.
Really, just pure sparkling water can do that?
Yeah, even
really?
Sparkling water has some of that essence as well. It's very minimal, so it's not dangerous in any way. It's okay to have it. But the more still water you drink, the better it is for you. And I'd say, even if you're comparing still water that you get in bottles versus tap water, your still water in bottles is probably a bit better than your still water, because with still water that you get, from your tap water, I should say, you get some fluoride in there, and that is fluoride and some aluminium and magnesium. All of these are elements that actually can contribute to problems with kidney function over time. You won't see it straight away because the kidneys are very, very resilient organs as well. But if you have still bottled water versus carbonated water or sparkling and tap water, then still is always going to be the best.
That's definitely the ideal.
Yes.
Perfect.
Yes.
And of course, to have plenty of, water in your diet as well in terms of just food and things like that.
Yes. Yeah, I think because we're always busy, it's very easy to neglect, having that. But we should try to push that.
And very finally, if you could give, say, 3 tips, I'm putting you a bit on the spot here. If you could give 3 tips that would give healthy kidney function, what would you say?
So, number 1, keep control of your blood pressure. That's very important. Number 2, keep hydrated. And number 3, keep active.
Brilliant. Thank you very much indeed. It's really been brilliant. Well, that's all we have time for today. I'd like to thank our guest, Mr. Shahid Mohammed, for coming in to the studio and sharing so much valuable information with us. And also to those of you who called in today as well. I hope you watching at home now have a great awareness about the issues surrounding kidney disease and kidney function and some of the things you can do to help yourselves as well. If you'd like any more information about the topics we've discussed on today's show, or for that matter on any of the shows in this series, then please do email us at healthshow@islamchannel.tv. We would always love to hear from you, so please do get in touch. Join me next time for another health show. We'll be discussing lots more topics for you in the rest of the series. In the meantime, goodbye for now. Assalamu alaikum.